The number of COVID cases in Chicago continues to tick upwards.
The city's COVID-19 risk level is now at medium, as it is for Cook and several suburban counties. Dr. Allison Arwady is the commissioner of the Chicago Department of Public Health. She joins us now live to make sense of our current COVID picture in the city. Thanks for joining us.
Happy to be here.
Well, it seems like everybody knows somebody who's getting COVID these days.
Yeah.
Is this strain a lot less severe than other strains? Are hospitalizations picking up, for example?
So it's not that it's less severe. It's just that most people at this point have learned some immune lesson from COVID. The best way is folks who are vaccinated and boosted. We tend to see pretty mild infections there. Most folks who are not vaccinated and boosted, there's not very many of them out there, but many of them have at least seen COVID in some form before and have at least some protection. So although the case numbers are really high, never before have we had high case numbers like that, and fewer than 200 people across all of our hospitals with COVID right now, right? Fewer than 20 in the ICU. So even the hospitalizations are going up a little bit, but mostly it's a lot of these more mild cases. But we worry more about older people and those, of course, with underlying conditions.
Speaking to that, as you said, a lot of people now have some experience with COVID in some way or another, and a lot of people are testing at home, which means they're not often reporting the outcome, right? They're not going to a clinic to find out if they're positive or negative. How does that impact how you battle COVID and what you do moving forward?
Yeah, so we take all of that into account. We actually are still doing a lot of formal testing here in Chicago, more than 20,000 tests a day. And if you go back a year ago, we were only averaging 6,000 tests a day. So even though there are many cases out there that are not formally being counted, always we've had cases that are not formally being counted, and we take that into account when we're saying how much COVID there is around. The thing is, we've always tested in hospitals, we've always tested deaths, so that's one way of sort of tracking what's going on over time. There is a lot of COVID right now, no doubt about it, and we need people. You can trust that at-home test. You don't need to go get a follow-up, but we need you to isolate and quarantine just like you would, with a formal test from a lab.
So unlike some other states, Illinois is still not requiring hospitals to kind of differentiate who's hospitalized because of COVID as opposed to showing up for knee surgery, they do a test and it comes back positive. And I guess I wonder your opinion on that and whether or not it really hampers our ability to have a sense of whether or not COVID really is causing a lot of hospitalizations, or is it just circulating so much the tests are picking it up?
Yeah, I think it's a combination. We have ways to follow sort of how severe our cases. We look at things like how many of the cases are getting hospitalized, how many of the hospitalized patients are ending up in the ICU and the ICU on the ventilator. All of those are lower at this point, which is good news. But I think there's still a lot that we're learning. I don't think we're done with seeing variants, unfortunately. So we'll see what's coming. But overall, as long as people are up to date with their vaccines and their boosters, those boosters make a big difference. We look over these last couple of weeks, people who are vaccinated and boosted 2 to 3 times less likely to get hospitalized or to die than folks who are unvaccinated, even regardless of if they had COVID before, regardless of anything else. So getting up to date is really important right now.
The numbers give us a lot of good info. There's something that just came out today. The FDA actually in the last hour or two, FDA soon to authorize Pfizer's COVID booster for 5 to 11-year-olds. What do we know about that?
Yeah, so we've known the FDA has been looking at that. We've known that it's very safe, that no concerns about safety. They were doing a study to make sure it was effective, that it was really bumping up that protection longer for the kids 5 to 11. So I'm not surprised to hear that the FDA looks like it's going to be giving it the green light. I want folks to know the CDC also needs to review and sign off. They're scheduled to meet later in the week on Thursday. So don't think you can go out and get a booster right away. We need all those external advisory groups to really weigh in. But yes, I do think we're on track to have boosters for 5 to 11-year-olds.
We only have 10 seconds left. I know Evanston High School reimposing mask mandates because of rising cases there. Yes or no? Do you see that coming back in Chicago?
If we get to what's called high, meaning not just a high number of cases, but a high number of hospitalizations, we've got a threshold. We start threatening the healthcare system. We could have to put mask mandates back in, but I hope we won't get there.
All right, we'll be watching it. Thank you so much, Dr. Allison Arwady, for joining us today. We appreciate your time.
Thank you.